Imagine a world where every healthcare provider has a conversation with every patient about their physical activity levels. Imagine it. In that world, healthcare providers have the time, the tools, the technology, the training, the billing mechanism to have those conversations. They also have the ability to assess physical activity, prescribe physical activity, and refer patients to a trusted, community-based resource like an evidence-based program, a walking program, and or to a qualified health and fitness professional. That's what we're imagining, that world. How do we get to that world? There are barriers in the way to that world, and it's really important for us to think about identifying what those barriers are and overcoming those barriers to help create that world. So today I will be talking about barriers to the movement prescription. So a little bit about me. I am a DRPH, a Doctor of Public Health. What is that? It's a little bit different from a PhD. It is a doctorate. It is focused on research and practice. So I'm a researcher and a practitioner, and I spend a lot of time translating and bridging that research practice gap. I mentioned the physical activity researcher. I'm the CEO and founder of Move to Live More. Why did I start my own company? I looked at the space and I didn't really see that anyone was doing what I wanted to do, which was to connect the healthcare sector, the health and fitness sector, and the communities sector to help people live healthier, longer, more active lives. And so that's what I set about doing with my company, Move to Live More. I am the past president of the Physical Activity Alliance, and I'll talk a little bit more about that coalition of organizations and the work that we've been doing in the physical activity assessment, prescription, and referral space. And I'm a fitness professional. I've been a fitness professional for 30 years. I still teach 3 hours of group exercise classes a week to students, all women. I work in an all-women facility from age 22. My oldest student is 88. And working with those students week in, week out, as a researcher, I am on the front lines. They are my best source of research about trends, about what's important to them, what is getting in the way of them achieving their health and fitness goals, identifying and overcoming barriers. I want to learn about you. So if you choose and if you're able, please stand when I list these various categories. Do you identify as a physician, a nurse, or healthcare worker? If you do, please stand up if you choose, if you're able. Please stay standing. Are you a counselor, social worker, or therapist? Please stand. Are you a psychiatrist or a psychologist? Are you a physical therapist or a fitness professional? I will stand. Wonderful. This is so wonderful and visual to see all this. Are you a student? Who did I miss? What did I miss? Scientist. Scientist, please stand. What else? Teachers. Teacher. Wonderful. All right. Anyone else? What did I miss? Podiatrists?
Community organizers.
Community organizers. If you choose, please stand. Wonderful. I mentioned that I was a fitness professional. I travel all around going to fitness please remain standing if you choose. I travel all around going to fitness conferences. It is at those conferences that I am most sedentary. I sit all day at these fitness conferences. So if you choose to join me, we are going to do a very short movement break. All right, everyone, let's take a deep breath in and blow it out. One more time, deep breath in and blow it out. Let's open wide, look at the ceiling, and round in front. And open wide, and round in front. And let's hang out here and stretch in front. Beautiful. And arms coming behind, stretch. And let's reach to the ceiling. Arms alternating, reaching toward the ceiling. Usually I do this with a hands-free mic. And go ahead and add a knee lift. Opposite knee, opposite arm, or not. Beautiful. Let's get the arms pumping, the legs lifting. Beautiful. And let's take our feet hips distance apart underneath shoulders and sit way back. Arms can come front or not. And come on up and back. And come on up. And back, and hold. Come on up. And legs together, and we're gonna take it to one side and back together, and the other side and back together. You can add arms, opening wide, coming back, and open. Beautiful. Good. How's everyone feeling? Better? Awake? Good. Nice. Let's just do 2 more each side. Good. And 1 more each side. Nice. Give yourselves room. Yes. There we go. And coming back. Let's take one arm to the side. Nice stretch there. And the other side. And stretch. Nice. And come back. And let's take 1 more deep breath in, hands together to heart center. We did it. Nice job. Good work, everyone. All right. Round of applause for all of you. All right. How's everyone feeling? Good? All right. Now, I have a question for you all. Who or what do you think is the most trusted source of physical activity information? The most trusted source of physical activity information, who or what? Yes? I'm sorry, say it again? Sharing? Physician? Anyone else? Physical therapist. It is primary care physician or a clinician in a primary care setting. In this study, the percentage of respondents citing trust was 78.5%, primary care physician or general practitioner as the most trusted source of physical activity information. Who or what do you think was the least trusted source? Government. TikTok. There, the internet. Fitness professionals. I heard someone say physical therapists. Fitness professionals, 44.2%. Less than half cite fitness professionals as a trusted source of physical activity information. So what do those two statistics say? What they say to me, the top one is that clinicians working in a primary care setting are trusted messengers. How do we harness that? How do we leverage the fact that they are trusted messengers? Let's look at the bottom. People like me who work day in and day out on physical activity, we are not trusted messengers. How do we become trusted messengers? Those of you who are healthcare providers, how much training and education in physical activity did you get in your education or continuing education? How much? A lot? A little? Little. I've seen different sources. Some are an hour. The most I've seen is 8 hours in medical education and continuing education. And when I talk with healthcare providers, and I'll talk a little bit about my research, they tell me, we don't have the training. We don't have the confidence based on that training. So how do we leverage those who don't have the training but do have the trust? And how do we build the trust among those who have the training? So that's what I'll talk about a little bit today. I want to talk about the patient experience. Again, I've seen different statistics over the years. Earliest is about a decade and a half ago. I saw a patient who saw a primary care provider in the past 12 months. 1 out of 3 were asked about their physical activity levels. 1 out of 3. This is a little bit more recent research which comes out of Tivity Health and their Senior Healthy Living Survey, where they asked, and this is older adults, it's the Silver Sneakers program, so older adults visiting their primary care physician in the past 12 months, what percentage discuss their level of physical activity? So it ranges to a little bit less than half to a little bit more than half. So we're still at 1 out of 2. So my world where I talked about every single patient being asked, we're not there yet. We have a long way to go. Now I'll talk about my research. So I want to set the stage for my research a bit. So about 5 years ago, I was doing my field work for my doctoral thesis, and I spent about a year working with a New England-based healthcare system, a community hospital, and they had a number, I think 25, 26 primary care and specialty practices. They were in the midst of being acquired by a very large healthcare system. And so I spent a year with them, almost a year, and I surveyed and interviewed physicians. And I just want to make one note here. When I talk about provider referral, I am talking about all different types of healthcare providers. In my research specifically, at this healthcare system, only physicians were using their exercise referral network. So I'll talk about physician only in this context. Generally, it's healthcare provider. So they had an exercise referral network that had been in place for about 10 years. 10 years, well established. They were going through a process where they were upgrading their electronic health record system at the time. So the electronic health record system figured prominently in the work and in the interviews that I had with exercise professionals and physicians. So I learned from the physicians that I interviewed, again, an exercise referral network that had been in place for 10 years. How often do you provide written exercise prescriptions to your patients? 0% always, 22% very often, 28% sometimes. So essentially splits down the middle, rarely or never a half. So this network had been in place for 10 years and still wasn't being utilized, only utilized by about a half. We're to the barriers. I promised we would get to barriers, and here we are. Asking physicians about their level of confidence in providing an appropriate exercise prescription with each component. Dr. Rosenbaum talked about the FIT principle, frequency. So we have physicians responding in that at best, they're a little bit more than somewhat confident with frequency. At worst, They're between slightly confident and somewhat confident around intensity. So again, this comes to the training and education which influences the confidence. So much work to do here. And then most importantly, really, is uptake and adherence. Uptake, do the patients follow through once? Adherence, do they follow through consistently over time? What was most interesting to me is that 28% of the physicians had no idea if the patients that they were providing exercise prescriptions and referrals to, they had no idea if they were following through. So how do we help them know? How do we help them understand? And so a lot of my work has been focused around taking this research and implementing it, not just at one healthcare system, because I worked in one healthcare system. There are a couple of other healthcare systems who are well known for their physical activity, prescription, and referral models. But how do we do this in every single healthcare system? So I started off by talking about this world and creating this world and overcoming these barriers. And I've listed these barriers here on the left. So time. Clinicians, healthcare providers say, they told me, I simply don't have the time. I know it's in the best interest of the patient, but I simply don't have the time. It doesn't necessarily bubble up in the 15-minute appointments, so how do we prioritize it? I don't have the tools or the technology. Even in this exercise referral network where the clinicians had access to the electronic health record system and the dietitians on the other end did, the exercise professionals were working to get access. They didn't feel they had the tools or the technology. We've talked about training. They didn't feel they didn't know who to send their patients to. They said, I know that I want to send them to someone who will support them in following through, but I don't know who that person is or what they look like. I don't understand the world of fitness professional credentialing. I know that I need them to have compassion. I know that I need them to have experience working with these specific populations. I know that I need them to have empathy. So how do we find those people? How do we build that trust? And of course, cost. Concerns about cost to patients in the exercise referral network I was looking at, it was an interesting network because it was both closed loop and open loop. So I'll explain that. With the closed loop, the healthcare provider could refer to the medical fitness center that was affiliated with the hospital and with the network, or they could refer out to a community-based resource, a nearby health and fitness studio or an independent fitness professional. And so if they were concerned about cost, they might not refer directly to an outside provider, or they might not refer to the hospital affiliated facility either. It was consistently a concern about cost. The medical fitness center did have a $60 for 60 days program that they could refer to, but then they were concerned about cost after that program had ended. So overcoming these barriers to facilitate the assessment, prescription, and referral within the system, and supporting the patient in engaging once, engaging over time, and then ultimately sustaining that behavior change over time, and setting up this feedback loop where those 28% of clinicians who don't know what's happening with their patients, they're getting reports back through, if given permission and explicitly laid out, through an outside fitness professional. If everyone's on the electronic health record, they're getting the information back in real time. So understanding the type of information that the providers want to get back, and that the community-based resource is equipped to provide, is absolutely critical to this knocking down silos, opening up communication and collaboration. I went back and looked at my research as I was preparing for this, and I hadn't focused specifically on mental health. As much of my research, I go in thinking that it's very much going to be a physical health project, and ultimately mental health becomes more and more important as I go on. But I'm curious, of the providers who are writing these exercise prescriptions referrals, what do you think is the number one condition that is prompting them to write the prescription or make the referral? What do people think?
Obesity.
You got it. Number one, obesity. Where do you think mental health came in the list of conditions? Do you think it was toward the top or toward the bottom? Bottom, okay. Not surprising to you all. Can I tell you what was surprising to me? Dead last was that the patient was not exercising regularly. To me, that should be number one. And what's interesting, so in the 5 years that have passed since I did this initial research, I've recently been working with a global fitness brand to implement an exercise referral program. And so I've been able to update my research. So I've been out talking with healthcare providers, and I have noticed a change. The biggest change is that the fact that their patients are not exercising regularly is their priority prompt for making a referral or writing a prescription. They care most about getting the inactive and insufficiently active patients just a little bit. Yes, they want them to meet the physical activity guidelines, but even getting them just a little bit more active is their priority. Another thing that I've learned through my more recent research is that they are very interested in getting information back, not what my hypothesis was, that they want tons and tons of data about what their patients are doing. What they want to know: uptake, adherence, so similar to my work previously, progression over time, but they want to know engagement. Earlier, someone mentioned fun and play. They want to know if their patients are having fun and are engaged and are doing it consistently over time. I use a lot of terms, and it's interesting to really see the extent to which prescriptions and referrals are not as readily understood in the realm of physical activity prescription or exercise prescription as one would anticipate. I know in my research I asked providers, do you write exercise prescriptions? Then they would immediately default to a conversation. And we know that patients are much more likely to follow through if they get something that's tangible, that's written, that's customized, that's individualized. And so when we're thinking about patient behavior change, which is really our end goal, that's our North Star, having a prescription or a referral is absolutely critical for supporting that behavior change. So assessment is really And our work, I'll talk a little bit more about our work with the Physical Activity Alliance. It's around developing standardized measures for assessing physical activity, essentially taking an exercise vital sign or a physical activity vital sign that can be integrated into an electronic health record and patient care. And then the prescription, really facilitating the ease of providers making that exercise prescription, and then that referral, which is that warm handoff to the community-based resource. Physical Activity Alliance, as in my introduction indicated, we're the largest coalition of organizations in the US focused on promoting health and well-being through physical activity. And It's Time to Move is one of our signature initiatives, and we focus on systems and policy change. So a lot of my work is focused on the bottom up. Physical Activity Alliance is focused on the top down. And so we have a 7-pronged effort to make physical activity assessment, prescription, referral a standard of care in the US healthcare system. One is around creating standardized physical activity measures for electronic health records. Second is about enabling interoperability, or this exchange of physical activity data. So I want to talk first. So these are the core measures that we have over a number of years developed using a health level 7 third-party accredited international process. These core measures around physical activity. So muscle strengthening, very important. We wanted to get this in because a lot of the systems that focus on physical activity referral now is really only aerobic. So minutes per day, days per week of aerobic, and days per week of muscle strengthening. Number 2, around this interoperability exchange of physical activity data, I learned through my research how important that electronic health record system was. And I know you have a love-hate relationship with the EHR or a hate-hate relationship with it, but we saw how important it was to have that. And so through the work that we've done with developing these standardized measures and enabling interoperability, as of next year, 2025, electronic health record systems will voluntarily have these fields to support clinicians in asking about muscle strengthening activity and aerobic strengthening activity. As of the following year, it will be required in order to be certified as an electronic health record system to have these measures included. Developing CPT codes for physical activity prescription. The Physical Activity Alliance has developed a resource where we've summarized all of the CPT codes which support assessment, prescription, and referral. We're working toward establishing insurance coverage for supervised exercise therapy. We're focused now on cost effectiveness and cost benefit analyses and gathering the data and the evidence base to help support this. We're bringing this into patient and clinical workflow. We've developed an implementation guide, and now we're in the process of having healthcare systems test the implementation guide. So if you are working with a healthcare system and are interested in potentially being part of this testing, I would love to talk to you. Connecting the clinic and community, and finally, quality and performance measures are the last step. And so this is still a number of years off, but this is the plan for developing this standard of care. We know that it has an impact on behavior and cost. Patients who get an exercise referral are more likely to meet physical activity guidelines. They're more likely to move from inactive to insufficiently to meeting the guidelines and exceeding. The referral systems promote improvements in physical activity for at least 12 months, so not just uptake, adherence within a 12-month time frame, but beyond. And average healthcare expenses for Medicare Advantage members who participate in a fitness program are lower than non-participants, so that receiver of the referral has impact. What can we do? What can we walk out of here and do? based on this. We can know the evidence, this linkage between exercise and physical activity and mental health. I want to point out a resource from the John W. Brick Mental Health Foundation called the Move Your Mental Health Report. It's a scoping review of all the evidence since 1990, which finds 89% of peer-reviewed research in that time frame found a positive, statistically significant relationship between exercise, physical activity, and mental health. We are often talking about testimonials and anecdata, and this summarizes and synthesizes the data and provides the evidence we need. Evidence should be integrated into the treatment of people with depressive symptoms or major depression, strongly considered for integration into the treatment of symptoms of anxiety, may play a protective role and help sustain mental wellness over time. So I encourage you to check out this resource. We can implement the evidence. I host a bi-weekly podcast where I interview thought leaders in the physical activity space. And I had the senior author of a study that got a lot of interest, a lot of consumer and media interest about exercise as a first line, not an alternative treatment, a first line treatment for depression, anxiety, and stress. We can work on building trust, building these trusted collaborative relationships. This is a resource that I put together that will help fitness professionals be the trusted receivers of exercise referrals from healthcare. They can build trust by informing ourselves, by educating healthcare providers of what we are credentialed and have the background and expertise to do with patients. Healthcare providers can take action. This is an American College of Sports Medicine action guide that supports healthcare providers in assessing, prescribing, and referring exercise. Again, overcoming that barrier of time. It lays out, if you have 1 minute with a patient, what can you talk about around physical activity? If you have 2 minutes, what can you do? If you have 5 minutes, what can you do? And it provides template forms for making referrals. It provides template forms for receiving progress reports. What can we, I know there's some fellow fitness professionals do, what can we do to build trust, specifically around mental health and physical activity? And this is a project that we did funded by the John W. Brick Mental Health Foundation. We did on behalf of the Health and Fitness Association, their foundation, where we surveyed fitness professionals trying to understand their interest, and their current knowledge base around addressing the mental health needs of their clients and students and members. And so we surveyed them. Almost 3/4 say it's important for fitness professionals to work more closely with mental health practitioners, but only 41.5% have the confidence in their knowledge and skills to establish that all-important exercise referral network. What can we as community members do? I said that a lot of my research, I go in thinking that it's going to be a project about physical health. I did a research study where I was looking at in-school physical activity interventions. I thought we were going to be talking about childhood obesity. We ended up, all my focus group members, talking about mental health and how do we support kids with their mental health needs. And so I ended up writing a book based on 20 interviews with thought leaders in the physical activity space around addressing physical health, mental health, academic development, focus, concentration, and supporting kids in moving more and feeling better. I would love to take questions. We have a few minutes. Come on up. I know you're all energized from our time together, and I would love to get any and all questions. The field is open.
My question is, how would you better regulate and even standardize potentially fitness professionals? Because I feel like a lot of the time, especially when you're talking about referrals in this industry in terms of working with medical practitioners and mental health practitioners, nobody really knows what we do.
Yes.
Fitness professionals, and there's a lot of different categories in terms of like Pilates instructor or a yoga instructor or a Zumba fitness instructor, or somebody who's working at a gym, for example, as a professional trainer. So I was really curious how you would handle like categorization, like I said, even maybe standardization.
Yeah.
That way.
Yeah, so the question is about how would we regulate or standardize fitness professionals, because we are such a diverse group. And a lot, as I mentioned, and you reiterated, a lot of healthcare providers simply don't know. They don't understand what our expertise is, what our credentials mean. And so, just short answer, because we're low on time, I was just part of a group that worked on an American College of Sports Medicine Health and Fitness Journal entire issue. I was the first author on one of the publications, which is on building trusted collaborative relationships between exercise professionals and healthcare providers. We talk about this. The entire issue talks about professionalizing the sector and moving forward. It's essentially a roadmap for fitness professionals like us to be trusted receivers of the exercise referral. So we can chat afterwards about getting you that resource. Yes.
I know we're short on time here, so I'll try to condense this, but when we're looking at brain-body connections in regards to mental health and wanting those good results, do you have anything to say on the use of bilateral movement, bilateral exercise in facilitating those brain connections, but then also its communication to the body and the health benefits?
Tell me more about bilateral.
Bilateral meaning like arms are moving either independently of, but it's you're moving along that bilateral line with your movements, and there's a lot of research to suggest that the brain, like my father's in-law is recovering from a stroke in the hospital, and he was a music teacher, so his movement with his hands, they're saying, is one of the reasons for his excellent recovery at this point. So I don't know.
Yeah, so I will point you to the Move Your Mental Health report. What I love as a fitness professional and what I think will be interesting to you, they actually go through different modalities and how each one works, how yoga versus Tai Chi versus aquatics versus strength training, what the evidence shows about the impact on specific mental health outcomes, and I think you will find that very interesting. I also just completed a specialty certificate on top of my fitness professional certification that was specifically focused on mental health and preparing us to best serve the needs of our clients, patients, students, members, whatever we want to call them, around mental health. So yes, I can point you to those resources, and you may find something specifically around that. I'm at 0. Thank you all so much.